Have you noticed that your doctor seems more concerned about your circulation than ever before? If you're living with diabetes or prediabetes, there's a good reason for that concern. Your blood vessels are working overtime, and without the right support, they can start to show signs of wear much sooner than they should. I'm talking about real, measurable changes that affect everything from your energy levels to your heart health, and yes, even your intimate health. Today, we're going to talk honestly about something many men over 50 deal with, but few feel comfortable discussing. Circulation problems related to diabetes don't just affect your feet or your heart. They can impact blood flow throughout your entire body, including areas that matter deeply to your quality of life and relationships. But here's the encouraging news. Research shows that certain nutritional approaches, when combined with proper medical care, can support your vascular system in ways that make a real difference. Before we dive in, I need to be clear about something. Everything we discuss today is educational information, not medical advice. Never start any new supplement or change your diabetes management without talking to your healthcare provider first. Your doctor knows your complete medical history, your current medications, and what's safe for your specific situation. That said, let's explore what science tells us about supporting circulation naturally. If you're new here, welcome to our channel. We focus on practical, research-backed health information for adults navigating life after 50. Hit that subscribe button so you don't miss future videos. And if you find this helpful, a like really helps us reach more people who need this information. Let's start with something you might not expect. Your nerve health and your blood vessel health are intimately connected, especially when diabetes is in the picture. When blood sugar levels run high over months and years, two things happen simultaneously. First, the nerves that control blood vessel dilation, that's the widening and narrowing of your arteries and veins, can become damaged. Second, the blood vessels themselves can develop problems with their inner lining, making it harder for blood to flow freely. This creates a frustrating cycle. Damaged nerves can't signal blood vessels properly. Blood vessels that aren't getting the right signals can't respond the way they should. The result: poor circulation that affects multiple body systems. For many men, one of the first places they notice this is in erectile function. It's not just a matter of hormones or age. It's often a circulation issue. And that's actually good news because circulation is something we can work on. Now, let's talk about B vitamins, specifically a form called methylcobalamin. You might know it better as vitamin B12, but not all B12 is created equal. Methylcobalamin is the active form that your body can use immediately without having to convert it first. Why does this matter for circulation? Research indicates that methylcobalamin plays several important roles in vascular health. It supports the protective coating around your nerves, called the myelin sheath, which helps nerve signals travel efficiently. When these signals work properly, your blood vessels can respond more effectively to what your body needs. Studies have also shown that adequate B12 levels are associated with lower levels of homocysteine, an amino acid that, when elevated, is linked to increased cardiovascular risk. Here's where it gets particularly relevant for men with diabetes. Many common diabetes medications, especially metformin, which millions of Americans take daily, can interfere with B12 absorption. If you've been on metformin for several years, there's a reasonable chance your B12 levels aren't optimal, even if you've never been tested. This is something worth discussing with your doctor at your next appointment. The connection to circulation becomes clearer when you understand that B12 deficiency can contribute to nerve damage, and those nerves control blood vessel function throughout your body. Supporting healthy B12 levels may help maintain better nerve signaling, which in turn supports better blood flow. It's not a magic cure, but it's a foundational piece of vascular health that often gets overlooked. Let me share something a Medicare patient told me recently. He's 71, been diabetic for 12 years, and on metformin the whole time. He mentioned to his doctor that he'd been experiencing numbness in his feet and some circulation issues. His doctor ran a B12 test, and sure enough, his levels were low. After several months of B12 supplementation under his doctor's guidance, he reported feeling more sensation in his feet and noticed improvements in other areas too. His doctor attributed the changes to better nerve function, supporting better circulation. Now, B12 isn't something you should just start taking on your own, especially in high doses. Your doctor needs to check your levels first and determine the right approach for you. Some people do fine with oral supplements. Others, particularly if absorption is really impaired, might need injections or sublingual forms that dissolve under the tongue. The typical supplementation range for addressing deficiency can be anywhere from 1,000 to 5,000 micrograms daily. But again, this varies by individual need. Good food sources of B12 include animal products like meat, fish, eggs, and dairy. But if you're dealing with absorption issues due to age or medication, food alone might not be enough. That's where testing and possible supplementation come in, always under medical supervision. Let's shift gears and talk about something most people don't get enough of, especially if you live in northern states or spend most of your time indoors. Vitamin D. You've probably heard about vitamin D for bone health, and that's absolutely true. But vitamin D does far more than just help you absorb calcium. It plays a significant role in vascular health, insulin sensitivity, and even hormone production. Multiple studies have found associations between low vitamin D levels and increased risk of cardiovascular problems. Research suggests that vitamin D influences how your blood vessels respond to signals, helping them maintain proper tone, neither too constricted nor too relaxed. For men with diabetes, this becomes especially important because diabetes itself puts stress on blood vessel function. There's also emerging evidence that adequate vitamin D levels support better insulin sensitivity. When your cells respond more effectively to insulin, your blood sugar control improves, which reduces the ongoing damage to blood vessels that high glucose causes. It's another one of those beneficial cycles. Better vitamin D status may support better blood sugar control, which supports better vascular health. Here's something many men don't realize. Vitamin D levels have been linked to testosterone production. Studies have shown that men with higher vitamin D levels tend to have higher testosterone levels compared to men who are deficient. Since testosterone plays a role in libido, muscle mass, and overall vitality, maintaining adequate vitamin D becomes important for multiple aspects of men's health, not just bone strength. How do you know if you need more vitamin D? The only way to know for sure is through a blood test measuring your 25-hydroxyvitamin D levels. Many Americans, particularly those over 50, are deficient or insufficient in vitamin D. Your doctor can test this during your regular checkup and recommend an appropriate dose if needed. Sunlight exposure helps your skin produce vitamin D, but as we age, our skin becomes less efficient at this process. Add in concerns about skin cancer and the tendency to spend more time indoors, and you can see why deficiency is so common. Food sources include fatty fish like salmon and mackerel, egg yolks, and fortified dairy products or cereals, but it's difficult to get enough from food alone. Supplementation with vitamin D3, the most effective form, typically ranges from 2,000 to 5,000 international units daily for adults with deficiency, though some people need more and some need less. Your doctor should monitor your levels after a few months of supplementation to ensure you're reaching optimal range without going too high. Yes, you can have too much vitamin D, which is another reason to work with your healthcare provider rather than self-prescribing. The key here is consistency. Vitamin D isn't a quick fix. It takes several months of adequate intake to build up your levels and start seeing the benefits in terms of improved insulin sensitivity, better vascular function, and potentially improved hormone balance. Now let's talk about something you've definitely heard of but might not fully understand in the context of circulation. Vitamin E. This antioxidant has been studied extensively for cardiovascular health. And while the research is nuanced, there are some important points worth understanding. Vitamin E exists in multiple forms, and the form matters. The most studied form is alpha tocopherol, but there's increasing interest in gamma tocopherol, which appears to have distinct benefits for reducing inflammation. As an antioxidant, vitamin E helps protect your cells, including the cells lining your blood vessels, from oxidative damage caused by free radicals. In diabetes, oxidative stress is elevated. High blood sugar generates more free radicals, which can damage blood vessel walls, contribute to plaque formation, and accelerate aging of your vascular system. Antioxidants like vitamin E work to neutralize these free radicals before they cause damage. Research suggests that vitamin E may help protect LDL cholesterol, that's the so-called bad cholesterol, from oxidation. Oxidized LDL is particularly harmful because it's more likely to contribute to plaque buildup in arteries. There's also evidence that vitamin E supports the production of nitric oxide, a molecule that's absolutely critical for healthy blood vessel function. Nitric oxide signals blood vessels to relax and dilate, improving blood flow. In diabetes, nitric oxide production is often impaired, contributing to circulation problems. Supporting this pathway with adequate antioxidants, including vitamin E, may help maintain better blood vessel flexibility and responsiveness. Now here's where I need to add an important caveat. High-dose vitamin E supplementation, particularly alpha tocopherol alone, has shown mixed results in large clinical trials. Some studies suggest benefits, while others have raised concerns about high doses in certain populations. This is why the current thinking favors getting vitamin E from food sources when possible, or if supplementing, using a mixed tocopherol formula that includes multiple forms of vitamin E rather than just alpha tocopherol alone. Good food sources of vitamin E include nuts like almonds and hazelnuts, seeds such as sunflower seeds, green leafy vegetables like spinach, and vegetable oils. If your doctor recommends supplementation, typical doses range from 200 to 400 international units daily, and mixed tocopherol formulas are generally preferred. The message with vitamin E is balance. It's an important nutrient for vascular health, but more isn't necessarily better. Work with your healthcare provider to determine if supplementation makes sense for you, or focus on incorporating more vitamin E-rich foods into your diet as part of an overall healthy eating pattern. You might be wondering at this point, do these vitamins actually help with erectile function specifically, or are we just talking about general circulation? That's a fair question, and here's the honest answer. Erectile function depends on multiple factors: adequate blood flow, healthy nerve signaling, appropriate hormone levels, and psychological factors too. No single vitamin is going to fix erectile dysfunction on its own. However, since erectile function is heavily dependent on good circulation, anything that supports overall vascular health has the potential to help. Think of it this way. The arteries that supply blood to the penis are quite small, actually among the smallest in the body. They're often the first place you'll notice circulation problems developing. Some doctors refer to erectile dysfunction as a canary in the coal mine for cardiovascular disease, meaning it can be an early warning sign of circulation problems that might later affect your heart. So while we can't say that taking B12, vitamin D, and vitamin E will definitely improve erectile function, we can say that supporting your overall vascular health, maintaining good blood sugar control, and addressing nutritional deficiencies creates a better environment for healthy circulation throughout your body, including in areas that affect intimate function. Let me be really clear about something else. If you're experiencing erectile dysfunction, that's something to discuss with your doctor, not something to try to treat on your own with supplements. Your doctor needs to rule out cardiovascular disease, check your hormone levels, review your medications, which can sometimes contribute to the problem, and help you understand what's going on. There are effective medical treatments available, and your doctor can help you determine the best approach for your situation. Now, let's talk about something delicious for a change: dark chocolate. You might have heard that dark chocolate is good for your heart, and there's actually solid research backing this up. High-quality dark chocolate, the kind with 70% cocoa or higher, contains compounds called flavonols. These are plant-based antioxidants that have been shown to support cardiovascular health in several ways. Studies indicate that cocoa flavonols can help improve endothelial function. Remember the endothelium we talked about earlier? That's the inner lining of your blood vessels. When it's healthy, it produces nitric oxide and helps regulate blood flow. When it's damaged, which commonly happens in diabetes, cardiovascular problems follow. Research published in reputable journals has found that regular consumption of dark chocolate or cocoa flavonols can lead to improvements in blood pressure, arterial flexibility, and blood flow. One study found that participants who consumed cocoa flavonols daily for several weeks showed improved flow-mediated dilation, which is a measure of how well blood vessels can expand in response to increased blood flow. Now, before you go out and buy a dozen chocolate bars, let me add some important context. We're talking about small amounts of high-quality dark chocolate, roughly 20 to 30 grams daily, which is about 1 ounce or a few small squares. We're also talking about dark chocolate with minimal added sugar. This is important for everyone, but especially for people managing diabetes. The chocolate needs to be at least 70% cocoa, preferably higher. The higher the cocoa percentage, the more flavonols you're getting and the less sugar. Some studies have used cocoa supplements standardized for flavanol content, which might be a better option if you're watching your calorie intake closely or really need to keep sugar minimal. Can dark chocolate replace your diabetes medication or fix circulation problems on its own? Absolutely not. But as part of an overall healthy lifestyle that includes proper medical care, blood sugar management, regular physical activity, and a nutritious diet, small amounts of high-quality dark chocolate can be an enjoyable addition that may offer some vascular benefits. Here's a practical tip. If you decide to incorporate dark chocolate into your routine, Work with your doctor or a dietitian to fit it into your meal plan appropriately. You might need to adjust other carbohydrate intake to accommodate it, depending on your blood sugar management strategy. Let's pull back and look at the bigger picture for a moment. We've talked about specific vitamins and even chocolate, but none of this exists in a vacuum. The most important thing you can do for your vascular health is manage your blood sugar effectively. Period. Everything else we've discussed today is supplementary to that foundation. Studies have consistently shown that good blood sugar control reduces the risk of diabetic complications, including vascular damage. Every percentage point reduction in your hemoglobin A1C, that's the measure of your average blood sugar over 3 months, translates to meaningful reduction in complication risk. Work closely with your healthcare team to get your blood sugar in target range and keep it there. Physical activity is another non-negotiable component. Regular exercise improves circulation, helps with blood sugar control, supports healthy weight, and has been shown to improve erectile function independent of other factors. You don't need to become a marathon runner. Moderate activity, like brisk walking for 30 minutes most days of the week, can make a significant difference. Always check with your doctor before starting a new exercise program, especially if you have existing health conditions. Diet quality matters tremendously. Focus on whole foods, plenty of vegetables, lean proteins, healthy fats, and controlled portions of complex carbohydrates. The Mediterranean diet, which emphasizes fish, olive oil, nuts, fruits, and vegetables, has strong evidence supporting cardiovascular health and is often recommended for people with diabetes. If you smoke, quitting is absolutely critical. Smoking damages blood vessels directly and dramatically increases your risk of circulation problems and cardiovascular disease. It's probably the single worst thing you can do for erectile function and overall vascular health. Talk to your doctor about smoking cessation programs and medications that can help. Managing stress is also important. Chronic stress affects hormone levels, blood pressure, and blood sugar control. Finding healthy ways to cope with stress, whether through meditation, time in nature, hobbies, or connecting with friends and family, supports your overall health in multiple ways. So where does all this leave us? If you're a man over 50 dealing with diabetes or prediabetes, and you're concerned about circulation, erectile function, or overall vascular health, here's your action plan. First, schedule a checkup with your doctor if you haven't had one recently. Discuss your concerns openly. Yes, it can be uncomfortable to talk about intimate health issues, but your doctor has heard it all before and wants to help. Be honest about what you're experiencing. Second, ask about testing your vitamin levels, particularly B12 if you're on metformin, and vitamin D, which most people should have checked periodically anyway. If deficiencies are found, work with your doctor on an appropriate supplementation plan. Third, review your current blood sugar management. Is your A1C in target range? If not, what adjustments can be made to your medication, diet, or lifestyle to improve control? This is the foundation everything else builds on. Fourth, evaluate your lifestyle honestly. Are you getting regular physical activity? Is your diet supporting your health or working against it? Are you managing stress effectively? Are you still smoking? These factors have enormous impact on your vascular health. Fifth, if you're experiencing erectile dysfunction, talk to your doctor about it. There are effective treatments available, from medications to devices to counseling, depending on what's causing the problem. Don't suffer in silence or waste money on supplements promising miracle cures. Finally, be patient with yourself. Vascular health doesn't deteriorate overnight, and it doesn't improve overnight either. The changes we've discussed today, improving nutrition, optimizing vitamin levels, better blood sugar control, take time to show benefits. We're typically talking about months, not days or weeks. Consistency and patience are key. I want to emphasize one more time that everything we've discussed today is educational information to help you have informed conversations with your healthcare team. I'm not your doctor, I don't know your medical history, and nothing here constitutes personal medical advice. Always consult with your healthcare provider before making changes to your health regimen. Circulation problems related to diabetes are common, but they're not inevitable, and they're not beyond help. With proper medical care, good blood sugar management, attention to nutrition, including addressing any vitamin deficiencies, and healthy lifestyle choices, many men see meaningful improvements in their vascular health and quality of life. If you found this information helpful, please hit that like button and subscribe to our channel for more evidence-based health content tailored for adults over 50. Drop a comment below and tell me, what aspects of managing diabetes concern you most? What topics would you like us to cover in future videos? Your feedback helps us create content that truly serves your needs. Also, check out our other videos on managing blood sugar, heart health, and healthy aging. There's a wealth of information here to support your health journey. Remember, knowledge is power, but only when you combine it with action and partnership with your healthcare team. Take care of yourself, advocate for your health, and don't hesitate to ask your doctor the questions that matter to you. You deserve to feel your best. And with the right approach, many men find they can maintain good vascular health and quality of life well into their later years. Thanks for watching, and I'll see you in the next video.